Hi, my name is Cynthia Glenn, and I will be presenting option number 2 via video, a case analysis and a treatment plan for schizophrenia spectrum disorder. The case is based upon the reading or several readings that we had in class, but specifically more to the video that was titled Psychosis, a clinical psychology session. So this presentation will again be based upon taking that video, kind of breaking it down into certain areas using some guidance provided, or actually using guidance provided by the professor to answer specific questions and provide specific information. So slide number 1 is case analysis and treatment plan for schizophrenia spectrum disorder. Slide number 2 provides a definition of the term or the word schizophrenia, or the mental illness that is schizophrenia, and the DSM-5 defines schizophrenia as the presence of 2 or more of the following attributes that I have listed: delusions, hallucinations, disorganized speech, grossly or disorganized or catatonic behavior, negative symptoms, and these have to have been in existence at least for, it says, during one time period or less if successfully treated. So with the young man that was interviewed in a clinical psychology, his name was Ephraim, his diagnosis, which they never said it in the video itself, we know that it was schizophrenia or psychosis. The doctor himself never said it, and Ephraim never came out and said it, but given that he had admittedly had illusions, was still having hallucinations as well. He was, like I said, disorganized speech. I didn't really see a whole lot of that, although that's a criteria. He had socially withdrawn himself. He felt like he was being watched. He didn't feel safe in any environment really, and his speech was very flat, is what it was. And he had pauses, but that may have been due to just him not feeling very comfortable about talking about anything. So to support the diagnosis of Ephraim, you see that his symptoms are clearly a part of the criteria to be diagnosed as schizophrenia. The video says that he was placed in hospital on involuntary hold, where they did provide him with medications that seemed to, at the point of the video being recorded, have helped him level out some of those negative symptoms. Slide number 3, which further discusses the diagnosis in the video titled Psychosis, a clinical psychology session. The patient, who was Ephraim, while being interviewed, did show signs of social withdrawal. He said that he had been that he said that he had socially withdrawn because he had already been in his room for a week and just kind of coming out just to get food, which was part of why his parents admitted him involuntarily. He was anxious, he was suspicious. He asked if maybe next time he comes in, if he could see if he was being recorded. He wanted to make sure that the psychologist, the doctor, wouldn't tell his parents. He didn't know. He did say that he was having hallucinations. Some of those he wanted to keep because it was his deceased grandmother that he was close to. He said that she kind of understood him, and her voice was a positive aspect of what he was hearing. The other side of that is that he did hear voices that were negative, that he did not know who they were or why they were there, but they were never there to cheer him on. So he didn't particularly care for those, but he definitely falls in the category of being diagnosed with schizophrenia, which is a mental illness that kind of peaks when you, in teenagers. You see it kind of come alive at that point. I did not see any catatonia or gross disorganization with this particular subject. He clothes seemed to be, he didn't seem disheveled. His movements weren't stoic. He didn't stare off into this unknown space and just kind of sit there for hours on end. He did talk. He was open. There was a moment in the video where the doctors noticed that he kept looking off, which is why he prompted him about the voices that he might be hearing. And the subject did say that he didn't hear them as much, but since it had been mentioned, he was kind of hearing them. So again, the diagnosis for schizophrenia and for Efren, it's a psychosis. He does meet that criteria according to the DSM, the diagnosis for schizophrenia. He definitely falls within the category, and he also, again, had been, he was on medication for this particular mental illness to help decrease those symptoms. Slide 4 discusses a description of the disorder, which is a part of the assignment, where we are to discuss how, in addition to the criteria for the DSM, how the particular mental illness, the etiology of it, the course, the effects of the disorder. So the etiology of it, and the etiology itself is the cause, the set of causes or manner of causation of a disease or condition. The etiology of schizophrenia, which I referenced the article Etiology of Schizophrenia, where it talked about how the etiology may be due to brain abnormalities, environmental effects, which that article also mentioned. And it was mentioned that brain abnormalities and environmental effects are kind of common to a lot of mental illnesses. So it's not the beginning and the end of it all, but definitely a starting place. Because with schizophrenia, they noticed, and this was kind of post-mortem, because they have to do they take all of this evidence most often after the person has passed away. But it's the loss of gray matter, and there's a decrease in the brain size, as well as the dopamine levels, which are very important in how our human brains transmit and do uptake, and how the brain functions. So when you have less of what you need for dopamine or more than what you need, there is an imbalance. Definitely with the brain size. If the brain is smaller or larger than it should be, there's going to be some deficiencies. And the gray matter, which then compensates, because we have two types of gray matter and white matter in our brain. And if it is finding that in the patients with schizophrenia that they have a total loss of gray matter, and as well as environmental effects. This article on the etiology of schizophrenia discusses how the environmental effects of schizophrenia are based upon genetics, which they've seen prenatal as well as perinatal, as well as how the mother may respond to certain illnesses. Just a lot of other genetic factors that have come into play over the years as the research has been done to say, you know what, because this particular mom or family was predisposed to these mental illnesses, definitely schizophrenia is kind of in the background waiting to surface. So in the case of the video, we did not hear of a specific case of familial mental illness, but there were a lot of mentions about how very suppressed the family was under the father. There was no openness to discussing emotions. It was a very structured family where the father was the head of it. No one did anything against him. Um, and culturally, they tried to get into some things, but I did, the cultural dynamics very well may have something to do with how the schizophrenia at this point in Ephraim's life manifested himself, because he did talk a lot about how he didn't want his family to know, and he was afraid that if they knew about his disorder, how they would think about him. So just the genetics of it all, the familiar repression of not being able to openly express yourself, or maybe talk through why I'm having these voices in my head and where did they come from. And also think that Ephraim was depressed, so he didn't seem to be able to really discuss the loss of his grandmother. So therefore, the environmental effects of his schizophrenia seems to weigh heavily on what was driving the particular mental illness for Ephraim. Slide 5 talks about understanding schizophrenia, and in the article by Diane Marsh, the Family Interventions for Schizophrenia, Journal of Family Psychotherapy, it says that schizophrenia affects approximately 1% of the population. It's always known that that mental disorder, any mental disorder, is complex. There's no black and white to it. No one knows why they happen. As the previous slide number 4 suggests, genetics, familial, environmental systems. There could be so many things why schizophrenia, medications that are legal or illegal, you don't know. Changes in brain composition definitely have a point to why some individuals have schizophrenia and others don't. May be caused by underlying deficits. Again, the other slide mentioned dopamine levels were low. Gray matter, which is very important in the brain activity, because the gray matter contains cell bodies that allow the brains to work. So if you don't have that gray matter, you're going to have some problems with how your brain functions. And also, you do have to know that symptoms can be treated or at least decreased by those that suffer from schizophrenia. The strict regimen, there's definitely plans that can be put into place when it comes to trying to manage or help someone that has schizophrenia manage those symptoms better, if that is what they want to do, if they realize that they have schizophrenia. So again, understanding schizophrenia is ongoing, but in the video itself, that is I think the goal of what the doctor wanted to do with Ephraim. He never mentioned schizophrenia, he never mentioned psychosis, but he did ask Ephraim what he wanted to do. And although Ephraim was kind of non-committal, he did say that he wanted to get back to whatever normal was for him. He felt like he was okay, but he would like to be able to he would like to feel like he used to, or at least function the way he used to, getting back to school, getting back to his family, without all of the voices. Again, he said he wanted to keep some of the more positive voices in his head, but again, Ephraim seemed as if he wanted to understand his schizophrenia, the medication, how it was affecting him. The treatment plan for schizophrenia, the one that I would put into place as asked according to the assignment. I've always loved narrative therapy because it just lets you talk and talk. You have a point to talking, but talking is therapeutic, period. And cognitive behavior therapy, which does provide medication, it provides you with a sense of self-awareness. It provides you with some accountability for yourself. So as the slide says, you would use narrative and cognitive therapy for, you would want to know what the current symptoms are. You want to know what the history of the problem is, the medications that are being used, the family background, the medical background, what type of supports are in place, what interventions will be used if, A, B, or C does not work, the overall task, as well as the end goal, the overall goal for this particular mental illness, schizophrenia. So with Efren, he did discuss his current symptoms, which were hallucinations and paranoia and anxiousness. History of problem, from what I can understand with the video, it hadn't been for a extended period of time, but probably about 2 months is what I was gathering. He was definitely on psychotropics to help with his symptoms, the hallucinations, which have decreased, but weren't all gone. Family background didn't mention there were any mental illnesses, but I think he was Filipino. They may not be a culture where they openly discuss mental illness. Medical background, Efren seemed as if he was healthy. He didn't mention any other type of illnesses that he had suffered from. System support, Efren did not seem to have that. His family, his mom, he didn't have friends, not really to support. So it was his doctor, and that was pretty much it. Interventions, there were some things discussed. Again, that's what narrative therapy would help Efren do. It would help him remain accountable for those days when he might feel himself moving towards a psychosis episode, becoming anxious, becoming withdrawn. You'll have things to do in place to kind of, or hopefully keep him from spiraling backwards. The overall task was to understand and better manage the psychosis, and the overall goal was to just get back to what his normal was, how he feels like his normal should be, which is leaving home, going to school, enjoying his life. Slide number 7 discusses the relevance of treatment models. So narrative as well as cognitive behavioral therapy, CBT. It's patient-focused, self-awareness, open dialogue, exploration of episodes, recognition of episodes, retelling of events to gain perspective. That is why I chose narrative combined with cognitive behavioral therapies. There's many peer-reviewed articles that support this, and again, I think narrative therapy for anyone. Talking is therapy. I said that earlier with Efren. It was therapeutic. He was opening up, and again, along with the cognitive behavioral therapy, which the medications which Efren was taking, if all of that can be combined, if that particular regimen can be cemented and Efren sticks to the plan that will be put in place, the narrative therapy and cognitive behavior therapy would be a great tool for him to help him recover, or to help him at least live a life where he is not falling to episodes of psychosis, because he would again realize what they are, when he's having them, and what to do. And then he has the tool of his psychiatrist that he can reach out to say, can we talk? Let me, and perhaps have him journal when he feels like he's going to have an episode. Just keep count of those things that might be his trigger. So that is why I would put in place narrative therapy as well as cognitive behavioral therapy in the instance with a person that is having, that suffer from schizophrenia and psychosis, that is able to handle the treatment plan that I suggested. Slide number 8 just speaks to, very briefly, specific interventions to be used from narrative cognitive behavioral therapy. And again, I've mentioned retelling of events and the medications. If I can talk, or not me, but if the patient can talk, and if and retell the story and maybe live in the moment, perhaps that'll be a trigger as to, okay, that is why this happened, or I remember this happening because I was doing this particular event. So with the narrative therapy and then the medications helping to keep the patient coherent and leveled as far as emotions, then that would be the two interventions that I would put in place, along with a litany of other things. But those are the two that stick out to me, according to prior classes and information that I've read. How is narrative CBT beneficial to the client, which is slide number 9? Narrative therapy helps the retelling of stories. It can provoke buried etiologies that the client might not have remembered, and that can trigger maybe a pathway to realizing why they are having these psychotic moments, or the psychosis. Reliving an episode of psychosis can be healing to the client and others affected, because if you're talking about it and maybe sharing your story, that's, I guess, for lack of word, bonding. You can heal yourself while you're healing others. Stress levels can be reduced when you're talking about something that is stressful. When you have a platform to discuss it, that always helps. And listening, non-judgmental ear, which is what the psychologist or the psychiatrist will be. Generational defense mechanisms revealed when you are in narrative therapy. The stigma of not talking about mental illness is overcome, because no matter how much research is done, mental illness is still a stigma. So if you can sit and talk to someone about something that you have and you don't understand, that's a weight that's lifted off and you move forward. That is what Ephraim was doing in the video. He couldn't talk to his family about it. He didn't have any friends. He didn't know who to turn to. So he's got these voices in his head, some good, some bad, but he doesn't know why he has them, and he doesn't know who he can tell that won't make him feel like he's less of a person for talking to him. Which is the next one. Talking openly and addressing the mental illness is therapeutic. And the cognitive behavioral therapy does these, the narrative therapy does these. The cognitive behavioral therapy piggybacks on the use of medications to help balance those imbalances that's happening in the brain. So that is how narrative CBT is beneficial to the client. Number 10, references that I used throughout this presentation to discuss the case analysis and the recommendations for a treatment plan for the schizophrenia spectrum disorder, and they are listed here.